Yeah, we got here about 10:30 last night. Yeah, we ain't been asleep, but we didn't leave.
I came here about 10 p.m. on Friday night to be able to get a spot. We're from Sevierville, Tennessee. We got here at 7 o'clock p.m. last night, and we're here for dental work. And I think we'll see a doctor too. This is our mom.
People start lining up days way in advance, driving hours. People drive from all over just to be at this clinic.
I've seen elderly people in wheelchairs covered with blankets who are so desperate to get care that they don't care that they're sleeping, literally sleeping on a sidewalk.
We see routine problems and routine physicals, but we see some sick people too. And we see people that have never seen a doctor.
You have a ticket? Three? All three of you guys?
The first patient this morning was a man who had something in his right ear. The second one was somebody whose blood sugar is 428. Now, the next patient, high blood pressure, dry cough for 2 weeks. Somebody with diabetes, needed medication, high blood sugar, also in a wheelchair and missing a foot. General checkup, possible urinary tract infection, high blood pressure, general checkup, cough and cold. Somebody who thinks they might have hepatitis, sinus headache, refill on blood pressure medication, and back and neck pain. Woman who had uterine fibroids removed 10 years ago and is having increasing symptoms of that again. Gentleman who has a rash. So, that's 15 minutes around.
Like, do you feel any chest pain or no?
Well, I do a little bit now, but I was figuring it's because I'm sick.
It's good that you're here.
Three's a little better.
Yes.
Here's 5.
Which pair do you want for your readers? I seen the sticker on the one pair of glasses. It said $99. I mean, that's just for the frame. And just to go get an eye exam is, I would imagine, probably $200. And so this is a blessing.
In a rural area, there is no place around the corner that can help you.
They've got to have transportation, gas, take time off from work. So it's a challenge in rural areas. When you think about, hey, I've got a 5-hour round trip just to go see a doctor.
We have lots of different kind of doctors here today with different kind of specialties.
It's like that pain in my stomach.
The best health care in the world is worth nothing if you can't get to it. And if they have health insurance, it is a $5,000 or $6,000 deductible, which might as well be $5 million.
Hi,
Hello.
Dr. Klink.
Hello.
You're the patient?
I'm Rebecca.
Hi,
This is my sister Danielle.
glad to meet you. So,
Came today to get my blood pressure checked. I've been told by several people over the years that it's high, and I don't have primary care. I don't have insurance.
and anybody in the family have trouble with high blood pressure?
My mother, she's in denial, but she has it.
Okay. And by denial, you mean she's not taking medication?
Yes.
Okay.
Many of these issues can be mitigated with a $4 or a $10 medication, but it's the $120 to get into the doctor
Again?
that is the issue, or it is the fact that no physicians in their area take Medicaid.
All right.
There's almost always some barrier to care that the rest of us take for granted.
The issue is that by exposure to a high blood pressure in this range, there's damage to the blood vessels in your body, damage to the blood vessels in your heart, damage to the blood vessels in your head, damage to your kidneys.
The doctor said that this is my wake-up call and that I need to follow up with someone to continue monitoring my blood pressure to make sure that everything's going okay. I've had a son now and he's 2 years old and I'm realizing that it's a problem and I want to be around to see him grow up. So.
None of this makes sense to me. Here we are, one of the most successful, richest countries in the world. And as I walk through the clinic, I always see somebody from last year, from the year before. And RAM is their health care. But we're a Band-Aid. We're not the answer, we're a Band-Aid. As long as our volunteers show up, we'll be there to help make a difference